Hi everyone, thanks for joining us today. My name's Melissa Docker and I'm the Manager of Policy and Development at Carers New South Wales, and I'm joined by Amy Pearl-Jones, who is the Support Officer at in the Carer Wellness at Home program for Carers WA. Today's webinar will be taking you through some information and advice about supporting carers in your workplace. So that's family and friend carers working in the aged care workforce. I'd just like to start by acknowledging the traditional custodians of the lands on which we're all meeting from today. For me, that's the Gadigal people of the Eora Nation, and pay my respects to any elders past, present or emerging, or to any Aboriginal or Torres Strait Islander people joining this webinar. So I'm just going to hand over to my colleague Amy, who will tell you a little bit about carers.
Thanks, Melissa. So carers. Carers are individuals who provide unpaid support and assistance to someone who has a disability, mental illness, chronic condition, terminal illness, or is frail of age. This care is often provided to family members, neighbours, or friends who are unable to care fully for themselves. In Australia, carers play a vital role in society and their contributions are recognised and celebrated. Carers play a vital role in supporting vulnerable individuals by helping them maintain their quality of life and often enabling them to remain at home. They reduce pressure on Australia's health, aged care and disability systems, providing unpaid care with significant economic value. Beyond physical support, carers offer emotional companionship, foster mental well-being and community cohesion. They also advocate for the needs of who they care for, ensuring their voices are heard and access to resources are improved. This contribution strengthens families, communities, and the broader social fabric. Next slide. Thanks, Melissa. Around 15% of Australia's healthcare and social assistance workforce are also unpaid carers, many of whom face significant challenges balancing their dual roles. Carers in paid work provide an average of 92 hours of unpaid care weekly on top of their paid work. 2/3 have reduced working hours and over 30% have left the workforce entirely due to their caregiving responsibilities. While more than half work 20 hours per week, 2 in 5 would like to work more but face barriers such as limited workforce flexibility, and these findings highlight the need for better workforce support to help the carers manage their roles effectively. Thanks.
So with carers often balancing significant amounts of work and care, many carers report they need increased support to maintain both roles. This includes greater flexibility of work hours, location and structure, and support from their employer to accommodate changes at short notice. Where carers are not supported to balance work and care, this can impact on their ability to participate in employment, as highlighted by Amy. The 2024 National Carer Strategy, the 2024 National Carer Survey, found that around 2 in 3 carers had to reduce their work in paid care. Of carers in paid care roles, more than 2 in 3 have reduced their working hours, and around 2 in 5 turned down or missed out on career opportunities. Around 1 in 3 had left the workforce altogether. Given the impacts of caring on a carer's ability to work, employers can play an important role in supporting carers to maintain their employment. Not only is supporting carers beneficial to carers themselves, it also provides a lot of positives for employers, reducing staff turnover, attracting and retaining skilled employees who can relate to the carers that they're supporting within their services, reducing absenteeism, increasing job satisfaction and productivity, and supporting employers to meet their legal obligations, especially under the Fair Work Act. So there are 4 steps that we've identified that employers can take to improve carer support and retention in their workforce. This involves implementing key principles that enable supportive workplaces for carers, increasing awareness of the carers in their aged care workforce, exploring alternative or flexible working arrangements to support carers to maintain their employment, and establishing or promoting other supports for carers in the workplace. From reviewing the practices of carer-inclusive employers, we've identified 6 key principles for supporting carers in your workplace. This includes having a strong understanding of your workforce, including how many carers are in your workforce and what their needs are. Taking a career-long approach, which takes into consideration when people may be more likely to be taking on caring roles and planning for this. Embedding reflective practice at all levels of the organisation to ensure continual reflection on how the organisation supports carers. Having buy-in from leadership in relation to creating a carer-inclusive culture. Fostering peer support opportunities for carers to connect and share their experience in the workplace. And finally, an openness to trying something new or taking new approaches. These principles are overarching and should be embedded at all levels of the organisation when considering how you can better support carers. In order to be able to effectively support carers in your workforce, it's important that you have a good understanding of who is a carer and what types of supports they may need. Creating a carer-inclusive culture and improving care awareness in the workplace will support and encourage carers to self-identify. It's also important that managers are equipped to notice signs that someone may be a carer, such as increased absenteeism, lateness, fatigue, forgetfulness, or stress. And it's important they're able to provide opportunities and have sensitive discussions, enabling self-disclosure. However, it's important that they're also understanding that a carer may choose not to disclose or only partially disclose part of their caring circumstances for fear of stigma or discrimination. Staff surveys may also provide an opportunity to support employers to better understand how many carers are in their workforce and what needs they might have, as carers may feel more comfortable disclosing their caring role anonymously. We often hear from employers, workplace flexibility is an important part of supporting carers in the workplace. We often hear from employers that it's difficult to provide flexibility to employees in the aged care sector as work cannot be done from home. However, taking a flexible approach often means tailoring work arrangements to meet carers' unique and changing needs relating to their caring role. This may look like greater flexibility in work locations or hours, or how they use their leave, creating opportunities for job sharing or cross-training or shift swapping. It could also involve redesigning jobs and roles to better meet the needs of carers and their organisation itself. While carers often benefit from flexible approaches, normalising flexible work practices and fostering open communication is important for all staff. To support aged care employers to visualise what some of these approaches may look like in their workplace, we've developed some case studies to highlight some of the less common approaches or that may be less heard of. The first case study is an employee named Julia. Julia works as a personal care worker at an aged care facility. She also provides unpaid care and support for her mother, who requires assistance with attending medical appointments. Julia is rostered to work on Thursdays, which unfortunately often conflicts with her mother's medical appointments, which are often scheduled on the same day and can't be moved. Julia speaks to her employer as she's concerned about how she can continue to manage to support her mother with her appointments while not missing out on work. Julia's employer or manager suggests that they consider roster pooling or shift swapping. This involves identifying staff with similar skill sets or qualifications who may be able to coordinate a shift swap between themselves as needed. It's important that in shift swapping or roster pooling that there are clear processes and timelines for shift swapping to support the effectiveness of this approach and enable managers to have clear oversight and adequate time to advise clients of changes. Creates clear expectations from the organisations around how shift swaps will be conducted and who it's acceptable to swap shifts with. The benefits in this instance, Julia and her colleague Sam have agreed to swap shifts for Julia's Thursday shift, and Julia will do Sam's Wednesday shift. The shift swap submitted through the facility's rostering system and approved by the manager, and this arrangement allows Julia to accompany her mother to appointments without taking leave, reducing her hours, or changing services for the clients who she's supposed to be supporting. The outcomes of this approach is that Julia is able to maintain her work hours and income, her mother is able to receive the support that she requires, and the facility can ensure continuity of care. It also supports team culture to be strengthened through mutual support and flexibility, and other staff may also want to take advantage of these opportunities to better support their own flexible needs. The second case study is of an aged care worker named Malachi. Malachi is a community-based aged care support worker. He's also a carer for his teenage son living with a disability. He requires flexible scheduling and occasional time off to support his son to participate in therapy and support services. His usual role involves direct care duties and a fixed roster. However, Malachi's been at the organisation for a long time and is a valuable member of the organisation. But his caring roles sometimes make it difficult for him to commit to physically demanding or time-specific shifts. In Malachi's case, he speaks with his employer about what he needs and the types of supports that would support him to maintain his role. They explore cross-training or upskilling staff across different areas of the business where they may be able to apply their skills in different settings to create greater coverage and enable staff to move into different duties temporarily that may better suit their availability or needs. In this instance, Malachi and his manager identify key skills required in another role that may suit Malachi, where his strengths are and his current caring obligations. Malachi is cross-trained in administrative duties and coordination tasks. On days where Malachi cannot provide physical care duties, he's rostered for these alternative roles. Regular check-ins are conducted with his manager and Malachi to ensure these arrangements meet his needs and they identify any potential opportunities for further support. The benefit of taking this approach is that Malachi sustains his consistent employment and income while developing his skills. He's able to continue providing care without the need for leave. It enhances the continuity of care across the team and supports other team members to also try their skills in other areas. It fosters teamwork and ensures greater role coverage across the organisation. It enables professional development and leadership opportunities where people can try their hand at new tasks and roles. It encourages a culture of continuous learning with staff able to continue to grow their skills across different areas of the business and cultivates a more flexible, skilled and resilient workforce. The final case study is of Ruby. Ruby is a community-based aged care worker supporting older people in their homes with daily living tasks and wellbeing check-ins. Ruby's a carer for her young daughter with complex health needs, needing to attend medical appointments and be available during school hours. Originally, Ruby's role involved long shifts and travel across multiple suburbs, which conflicted with her caring schedule and caused a lot of stress for her trying to manage both roles. Ruby raises her caring needs and support needs with her caring role and her support needs with her manager, and they discuss looking at designing a new role or the way in which they can redesign Ruby's role to better support her in her work. Job design involves reviewing an employee's availability, skills and qualifications and looking at how a role could better be tailored to meet the needs of the staff member while leveraging their strengths. It may also look like designing new roles within the organisation that include elements of other roles, address identified gaps within the business, or look to implement innovative new approaches to providing care. Ruby's manager redesigned her role in collaboration with her to better align with her strengths and availability while meeting organisational needs. They assigned clients closer to her home to minimise travel time. The shifts were adjusted to better fit her daughter's school and medical schedule, and remote options were included in the role, including phone-based wellness check-ins and documentation from home. Emergency leave and backup staff were also scheduled with plans in place so that if Ruby needed to step away, those could be put into place quickly, and opportunities for training and expanding her role to include care coordination tasks was considered, as this was a gap in the business and a further opportunity to better design the role around Ruby's needs. The outcomes of this approach were that Ruby were able to maintain her employment and continue to provide unpaid care without taking any leave. It created opportunities to strategically plan and arrange work for the business and for Ruby so that better met both needs. It promoted a healthy and sustainable workload. It created genuine collaboration between managers and employees in designing roles. It supported service coverage as they were able to fill some of the gaps that were existing at the time by redesigning Ruby's role with this in mind. And it created opportunities for skill development and career growth, as well as adaptable and resilient work environments. So in terms of, we acknowledge that many employers are already applying many different approaches to flexible work, often tailoring options to meet their employee needs. However, despite flexibility, it may not always work out for you or your employee, unfortunately. To support the effectiveness and success of flexible arrangements, there's a number of steps that employers can take that facilitate successful outcomes. This includes planning changes to the workforce, thinking about when staff may need to take time out to care or if there's any indications that this may be coming in the future, taking individualised approaches to ensure that flexibility actually reflects the needs of the employee, creating clearly defined arrangements and recording these to create clear expectations for the employee of what the employer is willing to kind of be flexible around and how that will work in practice, using trial periods to test out these new arrangements and see if they're working, regularly checking in to make sure that these are working for the employee and the employer, and adapting as circumstances need or change for both, again, the employee or the employer. So now I'll hand back over to Amy, who will speak to promoting or creating carer supports in the workplace.
Melissa. So to promote and establish carer supports in the workplace, it's important to focus on employment legislation, employer resources, and carer-friendly programs. Key legal protections for carers include the anti-discrimination laws like the Fair Work and the Equal Opportunity Act, carer leave provisions, so paid and unpaid carers leave, and the right to request flexible working arrangements. Employers can access resources such as the Fair Work Ombudsman, Australian Human Rights, the Human Rights Commission, Diversity Council Australia, and the Carer Gateway to better understand their obligations and foster inclusive workplaces. Carer-friendly employment programs like the Carers and Employers Program and the Care Inclusive Workplace Initiative provide frameworks, training, and accreditation to help organisations support carers. Next slide, thank you. To effectively promote and establish carer supports, organisations can also focus on key initiatives, launching new programs such as care awareness programs like the National Carers Week. They can raise visibility and recognition of carers' contributions. Centralising information for carers through platforms like SharePoint ensures easy access to resources while implementing carer-focused policies and procedures, embeds support into organisational cultures. Visual materials such as posters or flyers can highlight available supports. Establishing carer support groups within the workplace provides a safe space for carers to connect and share experiences. These strategies collectively foster a more carer-friendly environment and demonstrate a commitment to supporting carers' well-being. Thanks, Melissa.
Thanks, Amy. So the next steps, we will also be developing some additional resources and fact sheets on flexibility and flexible approaches, ensuring that you can access these case studies and really think about how these might apply in your work. You can also visit the Carers New South Wales Aged Care Hub for Providers page to access resources on attracting and retaining carers in your workplace. As you can see, these were developed in the first part of this project, and they are currently available, and they can help you with, as I said, attracting and recruiting carers as well. And you can contact us at any time or find out more about the Carers and Employers program if you'd like to continue to build your carer-friendly environment within your workplace. So thanks so much for joining us today, and we hope that that you were able to take a lot away. And yeah, please don't hesitate to get in touch if you have any questions. Thanks so much. Bye.